Who are the patients that need to be evaluated by a risk assessment manager? Kevin, who are the patients that should be seen by somebody like yourself who evaluates risk for breast cancer?
So when we're looking at risk for breast cancer, probably the most important factor is family history. Looking for patients, or patients should think, do I have a family history of breast cancer or of ovarian cancer, because they travel together? Are there many women in the family with breast cancer? Did they occur at a young age, in the 20s or 30s? Did some women have breast cancer in both breasts, or breast and ovarian cancer in one woman? And are there multiple relatives at this young age, or are there men in the family with breast cancer?
And so with those factors, should they be seen in a center like yours, the Avon Center in Boston? What level should women be seen at? What kind of center or person should be doing the evaluation?
So for a woman who has a strong family history of breast cancer, the thing we think about doing is genetic testing. Testing for BRCA1 or BRCA2 or now other genes. The people who do genetic testing are physicians with expertise in that, surgeons or medical oncologists, also genetic counselors, also nurse practitioners. So what you're looking for is a center where they understand how to do risk assessment, how to determine who needs genetic testing, how to order genetic testing appropriately, and to try to set up a meeting with that type of person if your family history is strong is the way to do things.
Very good. And they should come out of a center like this or being seen and evaluated with a piece of paper that says what their risk is. What sort of product does somebody get from being seen?
So when we see a patient who's at high risk this way, we evaluate their family history very thoroughly. In addition, we look for other risk factors that are less important: early age of first period, older age of going through menopause, first child late in life, or having no children. We look at those factors as well. We also look for biopsy factors. So some patients have a biopsy of what's called atypical ductal hyperplasia or lobular carcinoma in situ. These diagnoses, which your doctor would tell you about if you had them, would place you at higher risk. We look at the entire package. What are the risk factors relative to hormonal factors? What are the risk factors relative to family history? Risk factors relative to pathology? Put that together and say this person needs genetic testing, this person needs more intensive screening such as breast MRI. Some people need chemo prevention, drugs to prevent breast cancer.
So what they come out of really a set of recommendations about what the next steps are.
Exactly right. We try to order the genetic test if appropriate, interpret that genetic test when it comes back, or set them up on a screening schedule, or often say, you're not really at that high risk, just do what you normally do.
Very good. He's Dr. Kevin Hughes, and this has been some really vitally important information.
Hi, I'm Wendy Hartley, co-founder of Breast Cancer Answers. You know, not every breast cancer patient benefits from chemotherapy. When I was diagnosed, my doctor thought I would need chemotherapy. But then I learned about the Oncotype DX test, which helps your doctor decide if chemotherapy could benefit you based on the unique biology of your tumor. My test results revealed I had a very low chance of my cancer returning, which meant I didn't need chemotherapy after all. To learn more about the Oncotype DX test, click this button here.